So you know me, I'm Dr. Kritika Doshi, we've met before.
Yeah.
And I'm a pain specialist, so I've spoken before on pain. So today I'm going to discuss more about painkillers. How many of you have taken painkillers in your life? Rarely.
But taken.
Taken. So you have taken on your own, or they were given to you by a doctor?
Mostly
Both.
On your own, which ones have you taken?
Paracetamol.
Many Combiflam.
Brufen.
Crocin. So,
I have taken Voltaflam.
Voltaflam also. So along with the tablets, you get that leaflet of paper warning. Have you read that?
Nowadays it is not coming. Huh?
It is not coming. If you buy the whole strip, it comes. Buy. And does the chemist sell you any medicines?
No. Many times people come to
Just like
chemist
that.
and
They just
take.
So till now, there used to be a free sale of these drugs. They are called OTC, over the counter. But now, because there are so many side effects, people are getting complications. There are OTC, over the counter, which are safe relatively, and there are prescription drugs. So you will not get without prescription. What you said, Voltaflam, Combiflam. You will get one or two, but you will not get more. Okay. So you know of any of the dangers of taking painkillers?
Side effect on all organs. Mainly kidney.
Affects
Kidney and
Liver also.
stomach lining.
No, not really. It causes lot of acidity, gastritis. It can cause ulcers in the stomach. So many times you are given acidity reducing medicines, antacids along with that. Okay. So I will just tell you a little bit. Now you are talking of simple medicines. There are still higher medicines which people can get addicted to. So that is one more danger of painkillers. So everybody needs to take painkillers. There is nobody over here who has not taken in their life. So sometime or the other everybody has to take. So that way they are relatively safe. But there are some precautions that you need to take. And they are needed to reduce pain. Everybody gets pain when you have injury, when you have a headache, toothache. Something or the other goes on in our body. Sometimes we may need to take painkillers. So they are used to reduce the pain. Sometimes it can be tablets. You have mostly taken tablets or capsules. Sometimes when you have a fall or some operation, injections are also given. There are sprays now. Have you used a spray for bone pain? Rally spray. Correct. All these sprays are there. Then there are oils. Sensor oil. There are so many which contain some active ingredients. So oils are there, and there are patches. Patch also contains a drug which when you apply it goes into your body. So there are different types of medicines which come in different preparations. So even paracetamol, which is supposed to be very safe, Crocin, paracetamol, has side effects when you exceed a certain amount. So for a normal person, up to 2 grams, 50 kilo adult, 2 grams tak you can take, means 3 or 4 tablets in a day. But if you are drinking, if you have a liver problem, even 2 grams is too much, then you cannot take. Okay. So there are always some precautions with any medicine, however safe it is. So those with liver problems, paracetamol is avoided. In children, they can cause complications. So there are a lot of precautions to be taken. So whenever you take any tablet, always read that leaflet that comes with it, what are the problems. Some medicines can cause drowsiness. So when you are driving, it can cause problems. With alcohol, the effect can get exaggerated. And if you are taking some other medicines, some blood pressure, diabetes medicines can cause more acidic irritation. So you need to be careful. Now, WHO, World Health Organization, to make it easy for people to understand, for doctors also to understand, they have given a step ladder pattern. So if you have mild pain, there are certain drugs that you should use. If you have little severe, there are other drugs. And when there is very severe pain, like in cancer, then very strong drugs are used. So this is just a general guideline of what to do. Now Combiflam, Volini, all these come in the second level. Okay, Voltaflam. So they are quite strong drugs, and they do cause lot of acidity. And have you never had acidity with Combiflam? How many tablets have you taken? One. There are people who take every day. There are people who take every day, then they have lot of problems. So you should not take it very often. So there are no safe medicines, but these are relatively safe. Now PCM is paracetamol. I told you about paracetamol. Uh, no, what happens is there are two things. One is, I have told before that there are different types of pain. You may be taking a painkiller which is not helping that pain, so that is why you are not getting relief. Second is the pain intensity may increase because the cause of the pain is not treated. Supposing you are having spondylitis, if you don't correct it with exercise, physiotherapy, and you go on taking painkillers, the pain will go on increasing. Even if the painkiller is working for you, after some time, the cause of the pain is worsening. The cause is not, so that is there. And there are some medicines which can cause addiction. They are also there. So addiction can be physical dependent. So the craving is there. There is no pain, but they crave for the medicine. When there is nerve pain, like आयला मुंग्या येतात, आग होते, the medicines used to treat those are different. There, Combiflam, Boveran, all these don't work. Brufen, they don't work because it is a nerve-related pain. So they need different type of medicines to reduce that pain. In diabetes, you get burning of the soul. Many patients say कि पूर्ण अंगात आग होते. That is nerve irritation. So that is neuropathic pain, nerve-related pain. That does not respond to all these painkillers. So you can take 5, 6 tablets, but you will have no relief. So that does not mean addiction. That means it's a different pain. You need a different for that. Headache, migraine headache does not respond to all this. You need a different type of painkiller for that. So what pain it is? So you can take 1 or 2 days of self-medication. After that, you must show a doctor, identify what is the cause of pain, and then take a painkiller. And opioids. Opioids are morphine. Morphine, you have heard? ऐकले का? Hafim. Cancer pain साठी. Sir, you are understanding, no? In English, any problem? No. So English is comfortable, no? With everybody. So morphine is a very strong painkiller, the strongest painkiller that we have. And there are different preparations of it. Some of it are used for surgery. When you go for surgery, that time we give injection of morphine for pain relief. But after the surgery, you are not given. Okay, because during surgery there is very severe pain. Something is cut, something is broken. That time morphine is used. And cancer patients we use because their pain is very severe. So they are given tablets, patches. But for headache or some minor or not very severe pain, we don't prefer to give morphine. All medicines have side effect, including morphine. But morphine is a very good drug when used correctly. When used incorrectly, it can cause addiction, everything. Yes. Addiction is more common in non-cancer people. So if a normal person, if you and I, we take for headache or for back pain, we will get addicted. But a cancer patient does not usually get addicted because their pain keeps on increasing. Their pain is very severe. So for cancer patients, you must give them morphine when it is needed, when the doctor prescribes, not you. You will not get also, it is not given without prescription. Because it is such a dangerous drug, it is not given without prescription. But it is a very good drug when used correctly. The risk of morphine is addiction. Abroad, it is used for lot of pain, so they have lot of problem of addiction. In India, we still don't openly give morphine for non-cancer pain. So in that way, some patients suffer from pain because they do not get these drugs, but in a way, it also safeguards the patient because risk of addiction reduces. So if you already have pre-existing acidity, if you have diabetes, if you are on other medicines for say depression, anxiety, or for thyroid, or for sometimes blood thinners are taken, warfarin, aspirin. If you are on this, you already have some irritation of the stomach. And then if you take painkillers on your own, it adds to the irritation. So then you can get lot of heartburn. छातीमध्ये जळजळ होते ते, regurgitation होता है. When you sleep at night, you get up with cough because that is all GERD, gastroesophageal reflux. All the stomach acid comes up into the throat and you get that dry cough. Lot of patients get cough at night when they are sleeping because the acid comes up. So if you have some problem, you should not take painkillers just like that. Alcohol. When you take alcohol, alcohol also causes irritation of the stomach and it adds to that of the painkiller. So senior citizens, because the systems become slow as you become older. In children, because they are smaller, everything, they are more sensitive. So these are some of the people who are sensitive to the effects and adverse effects of painkillers. So you have to be careful if anybody you know is having all this. Don't just take medicines just like that. How to take it safely? Preferably always consult a doctor. One tablet you can take on your own, but if your pain persists, then you must show somebody. Don't just keep on taking medicine and going to work or pulling on. Self-medication is harmful, and take it preferably after food. Don't take on empty stomach. If you need to take, eat something. Have a banana, or if you cannot have, if you are in office or something, at least you can have a fruit. Don't take on empty stomach. Take something that coats the stomach, reduces the acidity. Avoid alcohol when you are taking these medicines. Drink lot of water so that all the stomach acid is washed out. Kidneys get flushed. And don't break the tablet, don't crush it, because you don't know how much dose you are taking. Somebody's weight who is 35 kilos and takes a tablet for a 50 kilo, the dose may become more. So you may think I'll take only half, but you don't know half mein kitna aata hai. So don't do that, and don't take 2 or more different types of medicine. Abhi crocin liya, pain kam nahi hua, combiflam bhi liya, kam nahi hua, then you take one brufen also. So lot of time people do that when they are but 2 or more medicines can cause problems. So it is, yes, ibuprofen plus paracetamol. Yeah. So it is already a combination, plus you may take something else. Everybody doesn't even read the labels. People don't read आणि किती milligrams आहे ते पण माहित नसतं. Okay. So बस ले लिया, because many patients they just go to the chemist gives them something, you don't even know what is there. Sometimes you can get allergies also with that, very dangerous allergies. So you should not take just like that. Always take, whenever you buy a tablet, you should have the ingredient listed, expiry date देखिए, उसके बाद लेना चाहिए. ऐसे ही एक tablet नहीं ले लेना चाहिए. You don't take milk in open, no? Oil भी open packet में नहीं लेते, तो दवाई भी ऐसे नहीं लेना चाहिए without expiry date, without the milligrams कितनी आहे. That is the safest way to take it. And there are some natural painkillers which you can take in your everyday life. So somebody who has pain every day, says back pain, spondylitis, you are going to have pain. So you add this in your diet, it will help reduce the pain. 100% तो नहीं होगा, पर pain थोड़ा सा कम तो होगा. This is anyway there in most of our Indian food. We eat all of this.
Clove is very good for toothache.
Toothache, clove oil. Most of the medicines are got from plants only. Aspirin is also from plant, willow bark. So most of the medicines are from here. And there are some non-medical things that you can do. So if you have stiff muscles and they are causing pain, a massage will give you good relief. Just hot fomentation can give you good relief. If you have injured your ankle or something, some bone pain, icing it, टाच दुखता, बर्फ से घिसेंगे तो अच्छा लगेगा. Icing is good for some things. Yoga and meditation helps a lot in reducing the pain. Today is World Yoga Day. So there are a lot of articles on health. So what I want to tell you is that you need to take painkillers. Means it is not that you should not take. You must take when you have pain, because it improves your quality of life.
No, but what happens in my family also, I tell them, that is the last resource. You can bear the pain. And many a time I have seen, because I have one, maybe in this my 63 years, headache एकदा दोनदा आलं असेल बस.
Hmm.
That's all. And for alien, if you can bear for some time,
It is
that
good.
help.
Yes, yes.
If it is unbearable, then you take.
Correct.
But people, थोड़ा भी हो गया चलो,
हाँ,
उतना भी bear नहीं करने का, they
they
take,
take it.
and then that addiction and everything starts.
That is also one thing. If it is something as simple as a headache, if it persists every day, if you are getting headache, then you need to find out what is the
What is the
cause.
cause?
What is the cause? Just don't take the medicine. Like
And even if we go to the doctor now, instead of the maximum medication, before medication will be painful
correct,
and antacid. to
correct,
cover the-
correct. So many people keep on taking, and then some people are also then diagnosed to have some other problem. Okay, so 2-3 days you can do some medication. After that, you need to find out the cause of this pain, and always take under guidance of the doctor. Any allergy or irritation, some newspaper reports have come that patients have these eruptions. Steven Johnson, sometimes allergy can be so bad that it can cause life-threatening problems. So if you have any irritation, redness, irritation, any swelling around the mouth, difficulty in talking, this is a very common indication of allergy. Immediately go to the doctor. Don't wait till tomorrow morning. अभी रात को दवाई लिया, थोड़ा सा irritation है, don't wait. As soon as it is not suiting you, you find that you are uncomfortable, you must go and show immediately, because you can be allergic to something in the medicine. Now, 2 conditions I will just mention, because arthritis, as you age, you are going to have some of the arthritis. It could be knee, it could be back. So you may have pain off and on. So you may need to take painkillers on a regular basis. But again, it will not be something like Combiflam, Brufen, Asanacil. It will be paracetamol, mild painkillers with some topical. Topical means some cream or something like that. And you can carry on with minimum dose of those drugs. So doctor will guide you how to do it. So that time you can continue taking those medicines, but with precaution of alcohol, seeing that your liver is not damaged. If you have liver problem, then he will change the drug. So there are some medicines that you can take safely for long term also. Long term means 3 to 4 months. Aram se. Capsaicin, chili. There are patches which contain capsaicin. They are very good for pain relief, especially for knee, herpes, नागिन जो बोलते हैं ना, हाँ हाँ. So for these, हाँ, black pepper extract. Chili, it is chili. Capsaicin is from chili. Chili extract is put in the patch. When you put it locally, it causes burning initially, but the pain reduces. So herpes जो है नागिन.
Nowadays you get that patch. I mean, based on that.
Yes, yes. You put it on the area of pain. So there are patches which contain this. There are patches which contain morphine, fentanyl, that is used in cancer. Okay, so you get patches which you can apply. So you don't have to take it from the stomach. So there is no irritation to the stomach.
What happens if that patch?
It goes directly into the blood.
But regular interval it gives.
Yes, there are patches of 12 hours, there are 24 hours, there are 72 hours, there are 7-day patches, there are different patches. There are patches containing a local anesthetic also. Herpes होता है ना नागिन, in that they have lot of burning, you cannot touch also over there. So a patch containing local anesthetic is put first, so it numbs that area, so then you can touch it. Then this capsaicin patch is put, chili patch, so that takes care of the pain. In cancer, sometimes they have so much of vomiting because of radiation, chemotherapy, they cannot take tablets. So then morphine or fentanyl patch is put for them. So the medicine goes continuously for 72 hours. They don't have pain. Then diclofenac, Voveran जो बोलते हैं ना, sometimes children may not swallow the tablet. So the patches are available after surgery. Instead of giving injection and causing pain, you can put a patch. So you get those patches containing that. So there are different patches with different medicines. So when somebody is not able to take orally, somebody has vomiting, somebody's operation is done in the mouth, they cannot swallow. That time these patches are useful. So arthritis, same effect, because it goes directly into the blood. From the skin it goes into the blood, just like an injection. So it has this, only it takes some time, it does not act immediately, it takes half an hour, 45 minutes to start acting. Some patches take 6-7 hours to start acting. Without affecting skin. So they are very good. These are all new inventions that have come. And cancer. So cancer, almost all patients at some stage have pain. Maybe during surgery, maybe during chemotherapy or radiation. Late stages, so many of them have pain. So for them they need painkillers. That time you should not say that try and tolerate. Okay. So that time they need painkillers, but with good precautions it can have very good effect and minimum side effects and good quality of life. So that is the end of my presentation, and if you have any questions we can discuss.
Sometimes the doctor advises कि आपको deficiency आपको vitamin लेना है.
हाँ, लेना चाहिए.
रोज लेना चाहिए.
डिपेंड्स ऑन कौन सा विटामिन है. अगर विटामिन डी है, इट इज़ अ फैट सॉल्युबल विटामिन, उसका लेवल ब्लड में आने के लिए टेक्स टाइम. सो दे में टेल यू 10 वीक्स 12 वीक्स, वंस अ वीक टैबलेट रहता है. B12 का इंजेक्शन रहता है. दे विल गिव यू द कोर्स हाउ मेनी डेज टू टेक, एंड देन इफ़ यू डोंट टेक इट इन योर डाइट. डेफिशिएंसी पहले हुआ क्यों? क्योंकि डाइट में कम है. अगर डाइट चेंज नहीं करते हो तो वापस 6 महीने के बाद डेफिशिएंसी होगा. So again you have to identify deficiency क्यों हुआ and correct that. So जैसे vegetarians में these are lacking in the food, so you have to eat fortified food, supplements regularly. धूप में जाते नहीं हैं, so we don't get vitamin D in spite of having so much sunlight in our country. So then make it a point, Saturday, Sunday when you have a holiday, sit in sleeveless clothes, shorts, to get some vitamin D.
Tell us bad side effects of painkiller. Like you say, up to certain limit, there is no side effect, or very little. And after that, there is a side effect. How this process happens?
Okay. Let me tell you about paracetamol. Safe. Crocin जो है ना, paracetamol is quite safe. How does it act? Exact mechanism is not known, but there is a central effect. See now how we get pain. Now when there is injury over here, skin breaks. So skin has some nerve endings. Those nerve endings send message to the brain. So paracetamol acts at the spinal cord and at the brain level. Here it doesn't act. So to act over here,
that sensitivity is blocked.
yes, at the center it reduces the pain.
The signal goes, but that
Yes.
sensitivity.
Now Voveran, diclofenac जो है, they act over here. When there is injury to the cell, in the cell there is something called as arachidonic acid. That pathway gets stimulated. So that pathway is where diclofenac acts. Okay. So जब भी injury होती है, we get swelling, but if you take डाइक्लोफेनाक, वो स्वेलिंग कम हो जाती है. सर्जरी के बाद यूजुअली डाइक्लोफेनाक इज गिवन बिकॉज देर इज स्वेलिंग, सो इट reduces the swelling, and that is how it reduces the pain. It prevents the arachidonic acid pathway stimulation.
That is about our
Injury.
stopping the pain.
How many days it is safe?
No, what after certain extra dose, how it affects our kidney?
No, see, now like I said, paracetamol 2 grams. Now if you take more than 2 grams, what happens? Now when you take anything, including food, food is digested by the stomach, then goes to the liver, and then the toxins or kachra is eliminated by the kidney. Okay, so liver की capacity रहती है, how much it can metabolize in a particular time. So paracetamol, so 2 grams you cannot take together, it has to be in divided doses, 500 3 times a day, okay, like that. So if you take more at one time, liver is not able to metabolize it, and that is how the side effects occur.
But then that directly goes to the kidney or...
No, the liver doesn't metabolize it only, so then the liver will get damaged when you take more. So somebody who's taking alcohol, who already has partially functioning liver, does not have a normal liver, and you take the full dose, then you can have complications. You can have. So whenever you take, you must take the smallest dose that is advisable. So 510 milligrams.
But then is there any symptom? One is the without knowing the organ is damaged. Another is you get some symptoms. So is there any process where the person can be, I mean, alert that something is happening?
For
Because suppose something because of prescription of the doctor and all this thing, it goes on. Doctor might have intention that you
see, if you
take-
see in any prescription, they write 5 days, 10 days. और what happens, घर का chemist है, वो घर में लाके देता है दवाई. They get for 2 months, 3 months. Doctor has not prescribed for that long. Many patients say that, I ask them, how did you get the medicine?
Is there any signal which you can recognize?
You
and
see,
then-
you may have
Something
bleeding.
is happening.
You may have bleeding in your stools, black colored stools. That is a sign of bleeding. Acidity. Okay. So, and sometimes you may not have any sign till it is too late.
or anything in the your urine, you
No, urine, no, nothing like that.
cannot be related to noise.
It can be, of course, of course. Levels will be high. So, maximum you should not take self-medication for 2-3 days. After that, you should not take preferably.
Might give rise to anuria.
No.
No?
If you already have a underlying disease, kidney problem, then yes. Like diabetics.
Diabetics have all organs are involved.
All correct, all organs are involved. So they have to be especially careful about taking painkiller because the kidney is very vulnerable, heart is vulnerable. Somebody who is not drinking enough water, abhi it is so hot, if you are dehydrated, dehydration also can cause some problem. Okay. So
Many of the painkillers affect high pressure,
blood pressure,
intraocular pressure,
uh, glaucoma. There are some which can interact with the medicines used for glaucoma. Drug interactions can occur. जो topical drops आपको देते हैं ना, those.
Suppose you are addicted for some medicine.
Hmm.
Last 10 years, 30 years,
Hmm.
addiction को आपको निकालना है. How can it be
It can be done. You have to go to a correct place where they will identify the addiction. First, it has to be identified. उसके बाद में it is not just physical dependence, there is also emotional dependence which has to be tackled. So counseling, all that is also needed.
If the doctor says don't leave the tablet, but I want to use it, then
No, if the doctor is saying don't leave, there must be a like what?
I'm taking depression tablets for last 10 something years.
Hmm.
मुझे छोड़ना है. तो
छोड़ना है तो अगर आप छोड़ेंगे वापस डिप्रेशन हो सकता है. So you have to prove that you are not depressed. So are you need, I mean your doctor will guide you on to that.
he says don't leave the tablet. Please.
See what happens, there is no harm in taking them under guidance. Why do you want to leave them? You are having any side effect?
But yeah, I take it 2-3 days and all that.
So you start exercising.
That is
Achha, that is why you were asking whether painkillers cause weight gain. What happens is agitation which is there, that reduces with these medicines. So when your agitation reduces, you become calmer. So your activity level must be going down. That is why the weight gain is there. It is not because of the medicine. And in depression, I think some people tend to eat more. That may be another reason. Comfort food. So exercise, you start. Acha, okay. So your doctor is the best person, whether you can stop or at least reduce the dose slowly. You cannot stop suddenly. You cannot stop suddenly. It has to be tapered slowly. With the doctor's advice. Best, yeah. And you can tell him that I feel ki I can be with a lower dose. You can try that, but consult the doctor always. Don't do it on your own. It can cause more harm.
Thank you.
Thank you. Thank you.